Hi, this is Jean Deschamps from Université de Montréal and Sono Uni and Sono Vault. This video will be talking about the concepts relating to transducer manipulation. At the end of the video, you will understand proper nomenclature for probe movement and understand tricks on how to properly use those movements. In order to properly teach ultrasound probe manipulation, we need to have and share a common language. This language has been codified in two manuscripts as seen above. Banner and all is more technically inclined, while the ASC guidelines incorporates objectives of image manipulation into description of the movements. This video will use Banner nomenclature for the sake of ease of understanding. The basis of understanding transducer manipulation is that we are looking at a 3D structure using 2D cut planes. As such, movements are meant to orient a probe in the direction of the structure we are seeking using what we are currently seeing as the frame of reference. As you can see, having the probe in the same position but changing the angle of the beam shows us dramatically different views. The top one is a parational long axis view, while the bottom one is a right ventricular inflow view. These are the 6 basic movements we will be using in describing this video: sweep, slide, rock, fan, pressure, and rotation. To slide a probe refers to the translation of the probe with respect to its long axis. The probe is held in the same upright position, but instead moves across the body in the same axis as the marker. ASC does use the term slide, but in their manuscript can be used and applied to whenever the probe moves across the skin independent of direction. Sweep means something entirely different. This is a live example of the end motion associated with sliding. The movement is following the same axis as the beam, oriented towards the probe marker. On the ultrasound clips of the lungs that you see here, the left is the head of the patient, and we are cutting in a parasagittal plane. As we are sliding towards the head, you can see a round rib at the top being displaced from the left towards the middle, reflecting a movement up. This is seen on the image on the left by the green arrow. To sweep is the second motion, and to sweep the probe refers to the lateral translation of the beam in the short axis of the probe. The probe is held in the same upright position, but is moved across the skin perpendicular to the index marker, or probe marker. This is a live example of the end motion associated with sweeping. The movement is orthogonal to the axis of the beam and to the probe marker. This is essentially the opposite movement to sliding. In this clip, we can see a short axis view of the LV. The marker would be towards the left shoulder of the patient, and we are cutting the heart in slices from base to apex. As the transducer sweeps across in the direction of the gray arrows on the image, we are moving from the mid-LV to the apex. To rock the probe refers to tilting the probe in the line with the long axis of the beam, or index marker. The image plane is kept constant, but the area of focus is changed. ASC uses a similar terminology to describe this movement and highlights this term when attempting to center an image. They also use an additional term called angling, which essentially refers to the same movement, but rather than centering an image, it refers to deliberately focusing specifically on a new part of the heart. This is a live example that shows you that we are essentially somewhat lifting one or the other side of the probe up while keeping contact in the skin. This is done in the same direction as the marker. The goal of this movement is to move things that are either on the screen or in the same plane as what is shown on the screen. Essentially, what is in the shadows outside of the beam may be brought into view, as is shown in this parational long axis view where you can see the heart being displaced, but not really changing the actual orientation or axis of the heart. To fan the probe refers to movements perpendicular to the long axis of the probe, but maintaining contact on a single point of the body. To fan a probe refers to tilting the probe along its short axis on a fixed point, essentially tilting at a perpendicular angle from the marker of the probe. The comparison is often made to fanning oneself, where your wrist is the single stable inch point. The effect is similar to the sweep, but the probe does not move from one point of contact. To fan is the opposite movement of rocking. Again, we are lifting the size of the probe slightly while keeping contact with the patient. This is done perpendicular to the probe marker. The fan allows us to bring structures that are not on the same plane as the ultrasound beam into view. Essentially, we are bringing things that are in front or behind the image displayed on the screen, as seen in this subcostal 4 chamber view, where you can see as we are fanning, we are bringing the IVC, the RA, and the aorta into view in different angles. One of the most commonly applied maneuvers is pressure. Pressure refers to increased force being applied towards the patient's body. This maneuver is perhaps overused by novice sonographers. More experienced users will realize that image generation is more about finesse and placing the probe at the right spot than actual force and pressure. One important point here is that we are not gliding the transducer on the chest at any point. We are simply pressing down. The amount of pressure depends on where you are on a patient's body. On the chest, it is often difficult to apply much pressure without hurting your patient. The abdomen is usually more forgiving in this aspect. The amount of pressure necessary should overall be minimal. When lots of pressure appears necessary, you should reconsider the window you are using. The last motion we'll look at is rotation. This motion is quite clearly rotating the probe around the axis that goes from the head to the cable insertion or the handle of the probe. This can be done clockwise or counterclockwise. There is no movement across the chest while this is being done. ASC also uses the convention rotate in a similar fashion. As you can see, rotation is done while staying in place. Rotation has different effects depending on where you are in the body. Overall, though, two main rules emerge. First, it makes things that are long round, and things that are round long. As an example, vessels seen their long axis will become cross-sectional with a rotational movement. Second, it helps align structures. A good example is being able to see the whole vessel in the longitudinal axis rather than having part of it disappear. Another good example is aligning the mitral valve, aortic valve, to be both visible in a parasternal long axis view. To summarize, we have used the Banner document as our main reference in this video. The ESC guideline is a bit more difficult to understand as it incorporates the goal of the maneuver for some elements and technical factors on the machine. Sweep refers to taking a long clip. ESC slide covers both sweep and slide in the Banner nomenclature. Tilting is simply a different term from fanning. In the ESC, the term angling is introduced. Angling is the same technical motion as rocking, but differs by intent or goal. Rocking in ASC aims at centering a structure on the screen, while angling is about showing a specific structure without necessarily centering it. To optimize your image, it is important to understand how these maneuvers combine. The basis is that there are multiple ways to get to a structure. As an example, if we are looking at a structure represented by the green bar, you can get to it from two different intercostal spaces, just with a different angle, using a fanning motion here. As such, you can slide or sweep to a different intercostal space, and then fan to angle the probe back into the right direction to look at the structure directly. Another important concept is to think about the frame of reference. Once you have an image, it should become your anchor as to where things are in relation to it. Stop for a minute, look at the chest, and imagine where things would be in relation to what you see. Then choose which movement will get you closer to that structure. As an example, if my goal is to look at the kidney and I start scanning anteriorly, I will see the liver. I know that the kidney should be more posterior to the liver, so I can either sweep posteriorly or try to increase my depth. If you frequently look at CT scans, you should have a decent idea of how structures and organs are placed in relation to one another. Use that knowledge. After all, we are essentially creating CT slices using ultrasound, or slices are just dynamic. The next trick is to slow down and use the maneuver deliberately and sequentially. I personally call this hypothesis testing of your image. Essentially, select a single maneuver and try one direction. If this does not make it better, try the other direction and see if you can get a better image. If you do, then move on from that spot to the next maneuver, repeating this pattern. Try to avoid randomly making multiple maneuvers rapidly. Slow down and carefully select them and you will obtain better results. Finally, from a pure technical standpoint, you have to understand that most of the beam comes from a small section in the middle of the probe. As such, you can have a large part of the probe sitting on a less transducing structure and still get a good window. On the chest, I am often sliding slightly over a rib and anchoring myself on it, kind of sitting on it, as a shelf. This opens a bit more space for signal penetration and stabilizes my probe. This is the end of the video regarding transducer manipulation. Feel free to contact us through our Twitter accounts with any questions or comments, or reach out through the Sono Uni or Sono Vault website.